Hello, everyone. We have a super cool video today. I have my pelvic floor physical therapist, Aditi Chandan, here with me to really talk about pelvic floor dysfunction. That is something that I have that is a big piece of my channel here as I talk about my journey through pelvic floor dysfunction. I have many videos. I have a playlist on it. And my last interview, I did interview my registered dietitian. And so I thought naturally we have to have Aditi on here to talk about pelvic floor physical therapy, but especially in terms of pelvic floor dysfunction after giving birth. Right. So Aditi's been helping me for several months. You are the second physical therapist I've seen. I was seeing someone last year, but then I found you and I'm so grateful that you are in my life. We have fun together. I feel like we have similar personalities. So what I want everyone first to hear about is you. If you could brief us on how you found this field of pelvic floor physical therapy and tell us briefly about where you work, which is where I visit you every week.
Well, I always joke that my entire physical therapy career was by accident. Mm-hmm. When I initially was in high school and first getting into college, I thought I was going to become a dentist. And then in the process of transferring schools, I stumbled across physical therapy and fell in love. So, I went to physical therapy school in Connecticut, got my doctorate degree there, and during that, our last year, we had a few courses, guest lectures more, on pregnancy, postpartum, pelvic pain, and especially bowel bladder incontinence. And as someone who's grown up in healthcare, it sparked my interest. So I went to my advisor. I asked, do we have any rotations where they do pelvic physical therapy? There was one not too far from where I grew up. One of my best friends' brothers had a room I could even, stay in for the summer. So it was the most convenient place to be. And it was an unbelievable experience. I fell in love with pelvic PT on the spot. Doing that just because knowing that that's what I wanted to pursue, I decided that I wanted to take my education further. And so I actually did a residency in pelvic floor physical therapy for both men and women down in Dallas, Texas, with the Baylor Scott and White system and Texas Women's University. And, that's a 1.5-year program, work full time, plus about 30 hours a week of school. After that, crazy me spent the next 9 months studying for boards. So I pretty much have taken this as far, almost as far as I can. And I can't imagine doing anything else. I've worked in, a few different jobs, since then. Currently, I'm working out of Warren, New Jersey with a private practice called AmeriCare Physical Therapy. There I am, a senior physical therapist, and I treat both orthopedic and, of course, my passion is pelvic physical therapy conditions.
And that's me, pelvic floor physical therapy. And I love you. I'm so glad that we met. This is great. Thank you for that background. And it just makes me feel so happy that, like, when you say you can't imagine yourself doing anything else, like, I love when people are exactly where they should be, especially professionally, because that's something I'm in the middle of doing. I'm on a journey myself to getting exactly where I want to be. So I'm very happy for you. And you're very knowledgeable. That's why you are here. And I am going to just hammer away with questions. Okay.
Let's do this.
Okay. I have several questions and I know we have limited time, but so we're going to kind of like try to just get to the point with all the questions and answers. My first question for you is to educate everybody. What is pelvic floor dysfunction and why was I not prepared for this after childbirth? Because that is when my issues began.
Well, pelvic floor dysfunction is kind of an umbrella term. Like any muscle group in the body, our pelvis is made up of muscles, nerves, bones, connective tissue. And anytime those muscles are not functioning at the appropriate level, we call that a muscle dysfunction. When it comes to pelvic floor, the two kind of gross categories are either overactive or underactive pelvic floor. Both of them can be insidious onset. Of them can be related to trauma. Some can be, due to pregnancy and postpartum. Some can be due to menopause. All these different factors affect our hormone levels. They affect our muscle activity. And at the end of the day, they affect our ability to either hold in urine and stool, void that, and also tolerate intimacy and intercourse.
Okay. And that was really good. That was a great explanation. Thank you. I love that. So
in terms of, you asking why you weren't prepared,
yeah,
I unfortunately have to blame that on our Western medicine system. In a lot of, European countries, for example, every new mom is given a pelvic exam before leaving the hospital, is taught how to do a Kegel appropriately, and is given a script for physical therapy saying that if you have X, Y, or Z symptoms, to go see a physical therapist. I feel like we here in the Western world, especially as women, have been taught to not talk about anything between our rib cage and our knees. So unfortunately, many people are ill prepared when something, comes up with their pelvic floor. Secondarily, so many people assume that either leaking or inability to empty bowel or bladder is normal after giving birth, and it doesn't have to be. There's more than just medications and pharmacology to address this. There's a lot we can do to address the coordination of the muscles themselves to restore you to a better, overall quality of life and function.
Yeah. Yeah. I mean, if somebody had said something to me previously, either it went in one ear and out the other, and I don't remember, or they didn't say it at all. I don't recall being prepared for this. I had very, very heavy babies, 10 and 9 pounds. So C-sections, but still, like, all that time, and I remember I couldn't walk at the end of my second pregnancy. I literally couldn't walk. So that is, so it's no surprise, I guess, that my muscles down there were affected.
That's a secondary part of it, that I think that we are facing, especially in this pelvic health world, is a lot of the doctors also don't know that we exist or what we do and how beneficial we can be. So even from, a physical therapy standpoint, on my own end, I spend a lot of time marketing and educating physicians. The internet and these videos like this have been fantastic because a lot of people may come in from more word of mouth or after watching a video like this because they didn't know that there was intervention for diagnoses such as this.
Yeah. So just the awareness, because I did not know there was pelvic floor physical therapy. You don't hear about it until you start having your own issue and you dive really deep into it. So who knew? And I will say that, just from I'm on social media a lot, and some people do come to me asking me questions. And from that, I've had women say to me, oh yeah, I pee my pants all the time. And they just make it seem like it's normal, or maybe they know it's a change that happened, but they just sort of accept it, and I want no part of accepting anything that doesn't make me feel good. I want my health intact as much as I can possibly control it. So, I hope people see this video, and if they need help, they do see their local pelvic floor physical therapist.
I'm pretty sure I'm going to have on my tombstone, no one should be peeing or pooping on themselves, and no one should have pain during sex.
So since we're focusing on post-pregnancy and pelvic floor dysfunction, is there a certain type of pelvic floor dysfunction that seems to be most common for women after pregnancy?
I feel like overactive pelvic floor dysfunction tends to be more common, both with cesarean and vaginal deliveries, because again, you've been carrying around this large weight on the pelvic floor, and then, regardless of how you deliver, those pelvic floor muscles do become affected. Oftentimes, the overactivity can present as either constipation, it can present as urinary urgency frequency, it can present as difficulty emptying bowel bladder, and it can also present as pain with intercourse that was not present previously.
Okay.
On the flip side, there's a high incidence of underactive pelvic floor, especially when, the first child is over 8 pounds delivered vaginally, if you have had an episiotomy or tearing, or have had an instrument-assisted delivery. I do feel like some of that is less common, though, immediately postpartum than some of the overactivity issues.
Okay, so if anyone's watching this and you're like, oh, light bulb moment. This is why this is happening. Now, in my case, I've been dealing with this for several years because I didn't address it. So I'm sort of one of those people that was just like, this is how my body is after pregnancy. So if it goes unaddressed for several years, for me, it was about 8 years. Does that make it harder for someone to fix the issue that they may have, or does it not really matter how long they've had this issue?
I think it depends on the individual, to be perfectly honest.
Okay.
Because as well as, just, having delivered children, there's definitely a genetic component, especially when it comes to things on the bowel side, whether it be constipation, IBS, Crohn's, and even some of the more fecal incontinence. I feel like on the more pain and bladder side, there's less of a genetic component, but in both cases, I'm not sure I can say specifically that the longer you've had it, the longer it takes to address.
Okay. And I guess it depends on the patient, and not only what you said about like just genetics and so many other factors, but how able they are to do the work on their own. Like, because there's a lot of body awareness with Definitely. Working certain muscles, where I feel like I'm at the advantage, I guess, because of what I do. I'm a personal trainer, and it's funny. I feel like because I have this issue, I feel like it's going to become something that I focus a little more on in my profession and bringing to light to other people. The more I learn.
To respond to something that you just said about profession, that actually is not always entirely true, because they've actually done research that, even I think it was between 40 and 60% of physical therapists, not pelvic physical therapists, but physical therapists across the board, if asked to activate their pelvic floor musculature, do not know how to do it.
Yeah.
Training in this. So it's, I think, more an issue of the fact that, we never think about or talk about this part of our body that the majority of women and men don't know how to activate, to contract, or release it.
Yes. And I want to make people aware of this part of their body because it's an area that you're right. Like, I previously never talked about it because I wasn't fully aware. I knew it was there, but it's just not something we talk about all the time. But it's important because I'm sure all women have some issues that they don't even realize. Maybe they're minor, and some people think like, oh, I feel fine, I feel good. Well, they don't know what feeling really good feels like. Next question, can we briefly talk about how someone can get an official diagnosis for pelvic floor dysfunction?
Well, there's a few different avenues for that. Of course, depending what symptoms you're experiencing, you could get that diagnosis from your gynecologist. It could come from a urologist, a proctologist, or I believe at this point, 47 out of the 50 states, we have what's called direct access, which means you yourself can walk in off the street into a physical therapy clinic and get evaluated for any of these symptoms, and they can advise you if they feel like you're having a dysfunctional pelvic floor.
Okay. Oh, that's cool. Didn't know that. That's great to know. Thank you. I personally actually also had an MRI, which was advised from my GI doctor, or my colon rectal doctor. So that's like another step in the process. My next question is coming from a personal experience. I didn't notice that I had issues with constipation until my firstborn was just about 1 year old. Okay. I'm not sure what that's all about. Is that strange? Is that weird? I don't know what to think of that, but I definitely know that these issues did not arise until after I became a mom. Can you just, I don't know, what are your thoughts about that? That it kind of took I remember she was 11 months old when I had like a severe, experience of pain and bloating and constipation, and then it just never stopped.
It's probably not the answer you want, but there is no predictor. I've had some people where this presents within 6 weeks. I've had some individuals where it presents 10 years later. So I don't think that it's common or uncommon for yours to have presented when it did. Like I said earlier, there's definitely some genetic components. There can be stress components. There can be dietary components. And some of it can unfortunately be just pure dumb luck that hormonal shift in your body has led to this almost new norm, for lack of better term.
Right.
But regardless of what it presents, therapy can be effective in addressing it.
Okay. Okay. Yeah. It's the body's complicated. It's not like, I don't believe ever that one thing causes one thing. It's usually a combination of things, and our life changes every day, every moment, right? With stress levels and hydration levels and what we're eating and what we're feeling. It's kind of like everything. And, and I've talked to you so much, and people here on this channel know that I also have IBS. So like, that's a whole nother thing. And I actually think I've had IBS for my entire life and didn't know it. I think I did because I know how I've been feeling.
I would agree with you that IBS usually does not come up out of the blue. You
Right.
probably did have it. And then for whatever reason, the period of time of growing the tiny human, delivering the baby, and those changes in the estrogen levels could have been enough to kind of spark that into the constipation postpartum.
Right. Right. Yeah, for sure. So with my pelvic floor dysfunction issues, you also like shocked me and told me that I have diastasis recti. Am I even saying it right?
You are.
Okay. So I have that, and that is like a big thing that women experience after childbirth. So can you explain just very simply what it is and how you actually told me that can contribute to my constipation issues?
So diastasis rectus abdominis, also known as DRA for short, quite literally means it is the spreading of the connective tissue of that top layer of our abdominals. So kind of that six-pack muscle, which we can see when we look in the mirror. Pretty much, 96 to 100% of women experience spreading of those abdominals during pregnancy because the abdominals have to expand very quickly to make room for the growing. After delivery, we ideally want that musculature and that connective tissue to come back together and reapproximate. For some individuals, whether it be due to genetics, whether it be the nature of their connective tissue, or whether it be, some poor core strength and body mechanics, it doesn't approximate quite as well. What that means is your core is not able to activate sufficiently to help, keep that intra-abdominal strength constant. But, furthermore, as a step further, it cannot then create pressure to successfully evacuate stool from your, bowels and your rectum.
Okay. Okay. So the abdominals, because you're always trying to help me figure this out. Aditi is literally teaching me how to poop. Okay. Like, which is ridiculous, but not. But so I know that we've been practicing lately. You're telling me to like contract my abdominals to cause the pressure on my pelvic muscles.
Right.
Because we don't want to cause direct pressure in the pelvic area. We want the pressure to come from in here.
Yes. So ideally, when you think about your core, think of it like a can of soda. You have to have the stability all the way around it. Then you have your diaphragm at the top and your pelvic floor at the bottom. What is supposed to happen is, when you take a deep breath in, your diaphragm flattens and your pelvic floor lengthens. And when you breathe out, it comes back up. So ideally, it creates a pistoning effect, massaging all of your visceral abdominal organs. Take that a step further for when you're trying to evacuate your bowels. If you are doing like straining or that closed glottis breathing, what people think of as pushing, instead of the pelvic floor musculature lengthening to allow successful emptying, it can actually end up contracting, therefore creating almost a closed door that you're trying to push against.
Okay.
When you push from your abdomen while exhaling, it is similar to, popping the tab of that can of soda. It's a controlled release of pressure, which then allows the stool to be forced more effectively out of that, rectal opening.
That's pretty cool. Thank you for explaining that. Thank you for that. That's very enlightening. I'm sure that is going to like blow people's minds, because I think a lot of people struggle with this. So thank you for that explanation. Okay. So I have one final question for you. biofeedback, electrical stimulation, that's in my mind, a big part of physical therapy, because that's what I mainly did at the location prior to you guys. So that's all I really knew of pelvic floor physical therapy, electrical stimulation, biofeedback. My question to you is it necessary for all patients to do this? Because my experience with you guys has been a lot more doing literal therapy in the form of pelvic floor exercises, learning how to engage those muscles properly. So it's been like a night and day experience for me, although we did recently dive into the biofeedback and electrical stimulation. So if you could just kind of talk a little bit about that and where you feel that's necessary.
Well, to be honest, I feel that biofeedback and e-stim can be beneficial for many people, but I do not necessarily think that it is necessary. Now, the reason I say that is our bodies take feedback from a lot of different systems, around us. The biofeedback and electrical stim, which you are referring to, either involves, stickers attached to your abdomen or your external kind of perineum, and then connected to either a computer or an external device that's giving you information about what your muscles are doing, or it involves a sensor inserted into either the vagina or the rectum that similarly will connect to an exterior device that gives you literal feedback on what your muscles are doing. This can be very beneficial for many people, especially if they don't have a strong awareness of what those muscles are, where they are, and how they function. Mm-hmm. Do I think it's necessary? Not necessarily, because some people do have a better body awareness than other people do. I also, like to always reiterate that biofeedback is really a global term that encompasses many different things. Yes, we have the purely pelvic floor biofeedback, which is internal or external, but something as simple as looking at yourself in a mirror, doing an exercise is visual biofeedback. Having somebody correct your form is auditory biofeedback. So I'm very hesitant to say blanketly that biofeedback is or is not the answer, because regardless of what body part you're coming to physical therapy for, we are giving you feedback. We are literally giving you biofeedback.
I get it.
And especially when it comes to things like overactive pelvic floor and or constipation, there is a lot of very strong evidence supporting using biofeedback and electrical stimulation. On the biofeedback end, like I said, it can enhance your awareness of when the muscles are activating and when they're releasing. And the electrical stimulation can facilitate or inhibit that depending on what the issue is.
Can you explain exactly what electrical stimulation is doing for someone?
So when it comes to the pelvic floor, electrical stimulation can act in one of two ways. It can either enhance the contraction ability of that muscle during squeezing, or it can actually help to downtrain or help that muscle to release, especially if there is a pain or overactivity component.
Okay. Why not talk about me just for a second? Do you recall, because I know you have a lot of patients, do you recall what you have seen with me recently? Just to from a personal experience, explain what's been going on with me we had 2 sessions of doing this recently.
Yeah, so for 2 sessions, we have done internal biofeedback with you, where we actually, connected that internal kind of rectal sensor to the computer monitor and actually showed you, okay, what are your muscles doing when you're kicking on? What are they doing when you're letting go? And then we added in the abdominal sensor and actually showed you that what is supposed to happen when you're trying to bear down to simulate having a bowel movement is your abdominal musculature is supposed to kick in, and your pelvic floor musculature ideally is supposed to, the levels are supposed to come down. Of course, I've never met anyone who's very comfortable having a sensor in their rectum, so therefore there's always some residual muscle activity there.
Right.
So in a situation such as this, we're looking for, those abdominal activation to go up and the pelvic floor to, maybe not rise much, but still, allow that sort of abdominal force to create that abdominal rectal pressure.
Right. Okay. Okay. And from my readings, do you feel that I'm in a pretty good spot? Like we're making progress. I've been with you for so long now. Well, a few months. Been with you a few months. Yeah.
I think you made some pretty immense progress. As we discussed earlier, I think that for you, it was not purely a pelvic floor issue. I think because of your diastasis, you were not able to adequately create that abdominal pressure to push on the rectal area, to push things out effectively. I also do feel that, there are certain individuals who say overactivate, whether it be their glutes or their hip musculature or the wrong part of their core. And I see this a lot with elite athletes, with dancers, with gymnasts, with fitness professionals, because sometimes you can be almost too fit where you don't know how to let those muscles let go.
Right. You kind of walk around like all tensed up and tightened up, keep the muscles tight. Yeah. That's fascinating. It's very eye-opening. Yeah.
There are people in the field who are quite literally anal retentive.
Yes. Keep the glutes tight at all times. I think recently you told me like I don't know if we were talking about like walking up the stairs or whatever, like just kind of like be a little more natural about it. Like you don't have to make every single step be so like perfect and like I'm squeezing my glutes with every step. But
something that people don't realize is that no muscle group in our body is supposed to work at 100% of the time.
Yeah.
Most of our resting level for all of our exercises is supposed to be about 30% muscle activation. And that goes for our pelvic floor too. So when you're doing your core exercises, when you're doing your bicep exercises, it's, the people who only train at their 1 rep max are at higher risk of injury or causing a dysfunction that wasn't there before.
This is great. This is good stuff. I hope people watch this whole interview because this is good stuff right here. Thank you so much. So good. All right. Well, listen, we're just going to like wrap it up here because we've been talking for quite some time, but you have been so helpful and this has been so educational and I had such a good time speaking with you and I just appreciate your time so very much. So
my pleasure.
Thank you so much. And I just want to encourage anyone that's watching to please look into your issue. If you have any sort of bladder issues, constipation issues, loose stools, whatever it may be, that's not normal. We don't need to live like this. And I think I just got to the point where I was like, this is not normal and I don't need to feel this way. And I need to be extremely proactive about figuring this out. And I've been very proactive and it's been a journey and it's not an overnight, fix. It takes a lot of dedication and discipline and educating yourself and empowering yourself with all the knowledge. So it's been a slow process for me, but I feel much wiser now than I did back then. So thank you so very much. Can you please, again, tell people where you work? Because, I'm in New Jersey, you're in New Jersey. If anyone in New Jersey, I got lots of friends. I know some people are struggling. If you don't know where to go, please tell us again where you work. And I think there's several locations, right?
Yeah, so I work for a company called AmeriCare Physical Therapy. We're based out of central New Jersey. We have 5 locations in Mountainside, in Garwood, Piscataway, East Brunswick, and Warren. And we actually have pelvic floor physical therapists in all 5 of our locations. But, if you're not in this area, I encourage everyone to actually go onto the AmeriCare Physical Therapy Association website to the section on pelvic health. There is actually a locator for pelvic PTs in your area. All you do is type in your zip code or, the city that you want to find a therapist in, and it'll give you a list of people who are treating a lot of these pelvic floor conditions in your area.
Oh my God, that's so good. I didn't know that. So thank you so, so much. That is awesome. Thank you so much, Aditi. I will see you next week.
Yes.
And again, I appreciate you so much. I'm so happy we met and you've helped me tremendously. And I think that everything you just said to everyone, all the education, it's going to help everyone so much that needs it. And I hope people take the next step in their journey to getting better. So thank you. And
Pleasure.
I'll see you later.
Later.
Bye.